Sierra Leone has fewer than 800 doctors for over 8 million people, far below the WHO's 1 to 600 doctor to patient ratio. This mother, who wants to remain anonymous, so we are calling her Aminata, has spent over a week in Freetown seeking care for her sick twins.
This is because there are not many specialized medical professionals in provinces. One of my children has a swollen stomach, and I had no choice but to travel.
Many here have to travel for more than 100 kilometers from provincial areas to bigger towns to get to hospitals. For many Sierra Leoneans, accessing healthcare is a constant struggle. Long waiting times, overstretched hospitals, and a severe shortage of doctors and medical staff make it difficult for patients to get the necessary care. Doctors here have heavy workloads, with some seeing up to 60 to 70 patients per day.
As junior doctors, we face burnt out and we face emotional, mental issues in terms of work overload in the hospitals. I remember doing 72-hour calls, having to see emergency cases, attend to critical patients at ICU and the emergency ward.
A recent study on physicians' turnover by a local doctor found that 70% of doctors want to leave the country due to poor working conditions and a lack of essential equipment. With an average salary of less than $400 per month, many also struggle to sustain a decent livelihood.
The conditions or service of doctors in Sierra Leone is still far from what is desired. And that is one of the main reasons why doctors feel that they should leave for the so-called living for greener pastures. Working as a doctor in Sierra Leone happens under very stringent conditions. Most times you will not have the equipment that you need. Most of the time you do not have the diagnostic facilities that you need to treat your patients.
The health ministry estimates that about 5,000 doctors are needed, yet only less than a fifth are currently practicing nationwide. He says the government has plans in place to address the crisis in the long term.
We are looking at developing a retention plan for the ministry through the Human Resource Office so that we have a proper plan as to how we can retain doctors. The government and the ministry is doing its best to ensure that the welfare of doctors is catered for, supporting them in their training programs, supporting them in their undergraduate level, and providing the necessary infrastructure that they need so that at least when they go to work, they will feel good in their workplace.
The healthcare crisis in Sierra Leone may have no quick fix, but for medical staff and the millions relying on them for care, the changes cannot come soon enough. Suleiman Barry, Africa Matters, Freetown, Sierra Leone.